So in some ways, the focus of the weekend is not just PCOS, but the way that PCOS and metabolic syndrome come from the same source. And, you know, certainly in our practices, PCOS is an issue, but metabolic syndrome is a really big issue. You know, and so many patients come with variations of the issues that are related to metabolic syndrome. You know, whether or not they've been diagnosed with that in particular, or even like diabetes type 2 in particular, or hypertension, you know, these things are all interconnected with each other, and there's a strong relationship between that and PCOS. So, you know, my hope is that you'll leave with tools to treat all of these things, which are just in some ways like the heart of our practice. People coming in with, you know, obesity, hypertension, those kinds of things are just, you know, people come in large numbers. And sometimes the tools that we've been given just don't feel like it's enough, you know, or cases come in where, you know, they have hypertension, but it has nothing to do with liver yang rising, and we're sort of left like, well, what do I do? Or, you know, there's obesity, but they have a really red tongue, and, you know, you say it's not kidney and spleen yang deficiency with accumulation of phlegm damp. So what do I do? How do I think about this? So that's what we'll be working with this weekend, and we can't really separate PCOS out as an illness. And in fact, it's one of the difficulties with PCOS, which is polycystic ovarian syndrome, is that it's often taken in the gynecologist's office as a disease that's separate from the whole metabolic syndrome issue. And you know, we don't want to do that anymore. We want to be able to recognize that this is a systemic illness that's not just a gynecological illness. And the goal is not to just make the woman ovulate or make the woman have a period. No, the goal is a deeper goal than that. And so we want to put it in a much bigger context. And by doing that, we will be able to also help people who have, you know, blood sugar issues, obesity issues, hypertension, those kinds of things. Just, I'll give you a little bit of my history and you know, where I work. I work at White Pine Healing Arts, which is in the barn that's next to my house. I live in an old New England village called Cushman Village, which is part of Amherst, Massachusetts, and this barn is the oldest structure in Cushman Village, and it was completely dilapidated when I bought the house, and we were considering just tearing it down because it was hazardous, but we renovated it, and now it's White Pine Healing Arts. So we have, you know, a large room where the classes happen, and a bunch of treatment rooms, and a beautiful big pharmacy with a raw herb pharmacy, as well as powdered extracts and some patent formulas, but primarily we do bulk herbs and powdered extracts in the pharmacy. There's a bunch of us that work there, and 3 dogs there all the time. So people who come there have to like dogs, and it's in the woods. If you do ever come there, it's quite lovely. I enjoy living there. So I started practicing in 1983 when I graduated from the New England School of Acupuncture, and then in 1990 I traveled to Hangzhou, and I was only going to do a 3-week little acupuncture program, but I got to the acupuncture clinic, and it was pretty much like Hua toe points for back pain and eyes of the knee for knee pain, and I just thought, I don't want to do this, and I asked, could I have a tour of the hospital, and I got the tour, and that's where I went to the gynecology department in the herbal part of the hospital, and sat there for a morning and ended up staying there for 5 months. You know, and I was there like 6 days a week with my teacher, and if she wasn't there, I went to pediatrics. But I stayed there for 5 months, and it was just really thrilling, because what was going on there in that clinic was so effective and remarkable, and a lot of it wasn't in the States yet. And so, you know, I felt a kind of a mission, like, this is so cool, like, somebody's got to start bringing this stuff. And, you know, I've discovered that probably 95% of what Chinese medicine has to offer isn't here yet. You know, there's so much more than, you know, we've sort of touched the surface, which is both frustrating in some ways, but also really exciting. And also, you know, if we get frustrated with not being able to understand something or being able to treat something, it's probably not the fault of the medicine. You know, it's more the fault of us not understanding or having enough of the medicine to be able to see clearly what's going on. So you know, then I came back and in 1998 I opened White Pine Healing Arts and taught a 3-year herbal program starting in 1999. So I was teaching, you know, the basics to students so they could sit for the NCCOM exam. And it was then that I had my students write case studies. And I started discovering that diagnosis was a big issue. Like, people's ability to diagnose was a really big issue, because these case studies my students would write were just all over the map. And so I really started looking into what goes on with diagnosis. You know, and what I realized is we're actually not taught how to diagnose in our schools, and there are reasons for it that are not the fault of the schools, but basically we know how to do intakes and we know how to gather a lot of information. So we have this information, and then we do this thing called come to a diagnosis, you know, and it's sort of like you know, you turn around and do something and voila, I've done something with all that information and this is my diagnosis. But what do you actually do with that information? How do you sort it out and prioritize it? And it's really kind of a free-for-all. There isn't a systematic way, or, you know, of sorting out that information to come to a diagnosis that you really feel confident in. You really feel like, oh, I know what's going on with this person for sure, and that can focus your treatment. So, you know, a good part of the reason that this has happened is what happened in China, you know, starting in the probably mid-40s, where for a bunch of reasons, including wanting to have mass health care and also medical schools that had a curriculum, that Chinese medicine started getting standardized. In addition, another reason was to make Chinese medicine look more like and be more compatible with biomedicine. You know, so Chinese medicine started to get standardized in this way that we call TCM now. It's what we call TCM, that takes this incredibly rich and diverse tradition and standardized it. And this happened in China, and then that's what has been brought over, and our schools are based on this same standardization.